it's been quite an adventure, and I'm glad that I have extremely healthy kids, and both of them have thrived, and it's more than just helping us live, it's helping us thrive. I'm Marsha Liss. My sons received their early care at MedStar Georgetown University Hospital. I was at the ultrasound. I was out 32 weeks, and Sam was in distress. Before I knew it, there were attendants taking my bed from the ultrasound all the way down to the delivery area, and we knew they were going to be a C-section because his twin took up a breech position very early and he never gave it up. And they were born a minute apart. It was very scary. His twin, who was so much bigger, was 3 pounds 12 ounces. But little Sam was only 1 pound 12 ounces. He was what they call a micropreemie, and he did have surgery. You know, when you're that little, they look at everything. And that's part of the thoroughness of being in a high-level NICU. And if you need to be there, you may not want to need to be there, but once you're there, they have everything and they're going to be sure everything's really good. So it was a very scary time, but it was a time that I was really so grateful to that maternity ward cocoon support system, to the attendants and the hypervigilance of the doctors without being alarmist. I'm saying, you know, we're going to get through this, it's going to be all right, and that was good. It helped push me through. So we got to know Dr. Siva and some of the other neonatology physicians pretty early, because for the first 2 years we went back every 6 months. Because they were preemies, and especially because Sam was so small, they want to follow you up a lot more. And so that also is another thing that gives you a wonderful confidence of, if something's not going right, they're going to tell us, they're going to find out. We won't be 8 years old and find out all of a sudden that there's a problem. The doctors and nurses at the NICU were really very, very special. It takes kind of a special dedication to work in an area with such fragile infants. And I think Dr. Siva exemplifies that very well. He's a very bright man. He really knows exactly how to save babies. He knows how to talk to the parents, and that's really quite wonderful. Sam now actually has turned out to be the athlete from being such a tiny little thing. He plays baseball, he runs, he's very good at school, he has this great group of social friends, and both of them have thrived. Every year, Georgetown holds a reunion for the graduates, as they call them, of the neonatology intensive care unit. As the boys got older, I realized that they were doing so well. It was really important to the parents who had other newborns, other neonates who were preemies, who had problems, to see my boys doing so well and to give them that hope and positive outlook of what can be. As we were preparing for Joel and Sam's bar mitzvah, we were looking at their portions and what was important to them. And Sam read the portion that talked about the midwives that saved the Jewish baby boys, including Moses and the whole rest of the Bible story. And he likened it to a phrase that says, when you save a life, it's as if you saved the whole world. And he says, when they saved these baby boys, just like when the neonatologists and the NICU saved me. I'm not sure where we would be today if the boys hadn't been born there, if they hadn't been born in a place that had that special intensive care, but they've certainly done the way they have because they had that great early start.